Welcome back. We're here for our last segment of the show. And before we close it out tonight, and yes, B-cell lymphoma is probably one of a more serious types of lymphoma. They have different types of lymphoma, but Dr. Maddie would probably be the person who would be better able to help you with that. It's an unfortunate disease to get. So one of the things that came up I attended a talk on Friday night, and I think it's actually Thursday night, and this talk was given by ACS, whose sponsor was American Clinical Solutions, and they had a ex-DEA agent talking to a group of physicians about the drug issues that have happened over the last 70s and 80s, and he has since retired, but he was a big into the pharmaceutical part of it, where basically drugs were being shipped in from manufacturers from India and foreign countries, and these were the internet sales, and there was actually a big stream of actually reputable products that were being made in India. After the plant closed, they would start it back up and actually build a lot of these products by name manufacturers. They had the labeling, they had the packaging, they had all the stuff, and it would be like the mice would creep into the facility, turn on the plant, start producing the products, and then when people would come back, they would, like, nothing would ever be changed, except a lot of product would go out the door. And when you're making pharmaceutical products, it's actually pennies to make products. So as far as their raw materials and things of that nature, they probably didn't notice much in the way of disappearance other than would maybe normally occur in the course of business. And then they would package those up, ship them over here, and ship them out to the internet pharmacies, which was a real problem. And he spent a lot of time on that, but a lot of the questions the doctors had for them was a lot of the issues where the pharmacies today are blaming the DEA for a lot of their antics, which are cutting out supplies, and, oh, we're not getting this and we won't get this, and 3 or 4 days later it's because of the DEA, it's because of this, it's because of that. And I'm going to tell you, and I'm going to tell you this because I sat in front of that ex-DEA agent, and that is a lie. That is a lie that's being perpetuated by the pharmacies to you, the normal people that need the medications. There is no shortage whatsoever that is because of the Drug Enforcement Agency. I'll swear on a stack of Bibles, and I hope to get this gentleman on the TV show with a phone conversation. He won't appear in person, but hope to get him on with a phone conversation so that you can hear what I heard and what I discussed with him, and that is all a lie being promulgated. It is the pharmacies who want to blame the Drug Enforcement Agency for doing their job. The Drug Enforcement Agency is going after the pharmacies because they are not doing their due diligence. So the pharmacies don't want to do the due diligence. So because they don't want to do it, or they live in the fear of it, they basically have cut the supplies off. And they've limited the supply. So what happens to these poor patients is, and I've seen it all this week, they come in, they get their prescription, I can't get it filled at Walmart, and I have to take the time to call the other Walgreens so they happen to have their shipment in this week, or this pharmacy doesn't want to do it, or they plan it out and they limit it. So this is somewhere up higher in corporate, whatever. And listen, I understand it. I mean, some people may be taking more product or more of the opioids than you would particularly like, but the DEA that's not their job. There is a diversion side of it, but the diversion side of it is mainly to make sure that the people that are being licensed are licensed to do what they need to do. And if it does get to the enforcement side because someone is not doing their job as a practitioner, that crosses that area. So the DEA has actually two different functions. One is basically the diversion side, which is just giving out the licenses to prescribe and dispense, and the other side, which is the enforcement or special agents looking at where things things are going bad and fighting the crime and the illegal drugs that are on the street. So to say that the DEA is not interested in doctors is to say that if a doctor is being a pill mill, and they'll eventually find out about it, then they will come in and do some enforcement on that particular physician or that particular pain clinic or things of that nature. That's what their job to do, and that's how they discover that if there's a 300% increase in a particular opioid in a particular small area and the pharmacy doesn't ask a question, then they should be asking those questions, because the DEA says that the pharmacies know your customer. And if there's just a huge number of prescriptions coming in and the pharmacists are just filling them and they're not paying attention, that's what they're supposed to do. They're supposed to make sure that the person is a legitimate customer and that the doctor was a legitimate doctor, that they are licensed to do what they need to be able to do. Short of that, that's basically their job. And if they notice there's a big increase, they're supposed to call and investigate and things going. But to lie to the customers and to tell them, you know, and to cheap shot them and say that, oh, well, you know, it's the DEA limiting us, or there's so-called 30% number where you have to have 30% of your prescriptions in opioids or we're not going to fill your prescription. That's a lie also. And if you are a customer and you're out there and you get told this, I hope you're man and woman enough to stand up and say that's a lie, and I don't appreciate it. I don't appreciate you lying to me. You can order the product that you need to have it in stock so that I basically can get what I need from a licensed physician who is licensed by the federal government and the state to prescribe this. He's in good standing. Why would you not fill that product? And to make people wait 24 hours, what is that? I mean, is that penalizing you because you need a medication? Penalizing you because you're in pain and because you go to the doctor? It's pain enough that you have to come into the office and wait 2 hours to get your prescription. And then you got to go to the pharmacy and make it wait 24 hours to get your medication. I mean, we have to spend an inordinate amount of time on the phone with prescriptions. I talk to, you know, the pharmacists. I talk with other doctors, and, you know, they're afraid to write the products because they think the DEA is going to come down on them. And that's absolutely hogwash. The DEA could care less if you're writing legitimate numbers of prescription product to a particular patient. The medical boards are out there to protect the public from doctors who and practitioners who are not prescribing effectively. Trust me, if you're doing it wrong, you're going to get in trouble. Eventually, the walls will come crashing down. But if you're practicing reasonable medicine, and that's what it is, reasonable, and you're practicing reasonable safety standards and you're trying to do the best for your patients, you have nothing to fear. But yet they want to make you out to be a criminal. Or if you go to the pharmacy, they want to call you a drug addict. Well, that's just too much medication. Why are you taking that? In some cases, I would agree. There are a lot of medications, and there's a lot of things, and you know, and I see a lot of prescriptions that are just as dangerous. 3 different blood pressure pills and medications that interact, and all they're worried about are the opioids. So again, that is a lie, and I hope to get Steve on the phone one of the days, who's the next DEA agent. We just got a few minutes left, and Vern was showing me this before the show, and it's a nice pamphlet about getting connected, and I want to say that a lot of people out there that don't have an antenna for this, or you have Dish Network, or you have something along that, I believe these are going to be mailed out to the public. You can call. You can always call the station if you have somebody who you might be interested in watching the show or getting information. I think they have advertisers on here that you can get some discounts, and there's some $100 of stuff on there. So to let you know that that's going to be coming your way, and there is a way to get an antenna so you can get my show and get all the other programming that this great channel puts on. So that being said, look for that coming in your mail, and we can you can pass that on. I certainly appreciate people letting me know that they enjoy the show. Okay, we have Roberta. Roberta's on the phone. Roberta?
Yes, doctor. I was told by Miss pharmacy that they wouldn't fill my hydrocortisone pain prescription because I'm a snowbird.
Because
Is
what?
that legal? Is that legal?
I couldn't hear you.
I said that this pharmacy would not fill my pain medication because I'm a snowbird.
Because you're a what?
A snowbird. I'm
Oh,
only here
really?
8 months of the year.
Oh my goodness. Well, we've got 1 minute left before we're going to cut the show, but I can tell you that is not legal at all. There are only 3 reasons a pharmacist can refuse to fill a prescription, maybe 4, but the last 2 are mingled. 1, it's a forgery. 2, incomplete information, or they think it's in your best interest not to fill the prescription and they have to get the okay from their doctor. With that, I got to sign off, I think. We got 1 minute left. But Roberta, please, that is an absolute lie. You need to get that pharmacist's name and number, and you need to report him to the state board. That was a violation of the NRS. He cannot refuse to fill your prescription because you are a smoker. I cannot believe that. And I'm sorry if that happened to you. I don't know where that took place, but call me next show and we can discuss it. And again, call the State Pharmacy Board. They'll help you file a complaint. And with that, I say good night, and I'll see you here again on the next Monday night. Thank you.